What does risk management really mean in medical devices? Is it just about identifying risks, or is it something more? In safety-critical systems, risk is not optional. It must be understood, controlled, and continuously monitored. So here is the key question. What happens if a critical risk is overlooked? In medical devices, this can directly impact patient safety. That is why ISO 14971 is one of the most important standards in this domain. It defines how risks are identified, evaluated, and controlled. And in this video, we break down how this process actually works. Why is risk management so critical in medical devices? Let's think about this. A medical device does not just process data, it interacts directly with patients. So here is the question. What happens if something goes wrong? A failure can lead to a hazardous situation, and that hazard can result in harm. In some cases, serious harm. This is what makes medical devices so critical. It is not enough to identify risks. They must be controlled and reduced to an acceptable level. And this is exactly what ISO 14971 is designed for. So what exactly is ISO 14971? At its core, it is a risk management standard for medical devices. But here is the key question. Is it just about identifying risks? Or is it about something more? ISO 14971 defines a structured approach to identify hazards, evaluate risks, and control them. It connects these elements into one consistent process. And this process does not stop after development. It continues throughout the entire life cycle. This is what makes it so important. It is not just a method. It is the foundation of safety in medical devices. So how does the risk management process actually work? ISO 14971 defines a structured approach. It starts with hazard identification. This means understanding what could go wrong. Next, the risks are analyzed. How likely is it, and what is the impact? Then, the risk is evaluated. Is it acceptable, or does it need to be reduced? If not, risk control measures are defined. These can include design changes or protective mechanisms. And finally, the remaining risk is assessed. This is called residual risk. Now here is an important question. Is this process done once, or does it continue? In reality, it is iterative. It continues throughout the entire life cycle. What are the outputs of risk management? What do you actually get from this process? The first result is a structured set of hazards and risk situations, each one clearly defined. Then, you have risk evaluations. Decisions are made. Is the risk acceptable, or does it need to be reduced? Another key output is risk control measures. These define how risks are mitigated. But here is an important question. How do you prove that these measures actually work? This is where verification comes in. And finally, everything must be traceable, from hazard to control to verification. This traceability is essential for both safety and compliance. Where does ISO 14971 fit into the bigger picture? It is not just a standalone activity. Risk management has a central role in medical device development. It directly influences system design. Decisions are made based on risk. It is also closely linked to software development. Software must implement risk control measures, and it connects to quality processes. Everything must be documented and traceable. So here is the key question. Is risk management just one step, or is it something that drives the entire process? In reality, it influences almost everything. What challenges arise in practice? Risk management sounds structured, but in reality, it can be quite complex. One of the biggest challenges is identifying all relevant hazards. It is easy to miss less obvious ones. Another challenge is defining realistic risk situations. These must reflect real system behavior. Risk evaluation is also not trivial. So here is the question. How do you ensure consistency across different teams? Selecting effective risk controls is another key challenge. They must actually reduce risk, not just look good on paper. And finally, traceability and documentation. Everything must be linked and clearly justified. There are several common misunderstandings about ISO 14971. One of the most common is that risk management is just documentation. But here is the question. Is documentation the goal, or is it just a result of the process? Another misconception is that it is a one-time activity. In reality, it is continuous. Some also believe that risk can be eliminated completely, but that is not realistic. Risk can only be reduced to an acceptable level. Another misunderstanding is that all risks can be quantified precisely. In practice, a combination of approaches is used. And finally, risk management is not separate from development. It is deeply integrated into it. Let's summarize the key points. ISO 14971 defines risk management for medical devices. It focuses on identifying hazards, evaluating risks, and controlling them. This process is applied throughout the entire life cycle, and it is closely integrated with development and quality processes. So here is the key takeaway. Risk management is not just a step. It is a continuous activity that ensures safety. And here is a final question. What is more important? Identifying risks or controlling them? In reality, both are essential for a safe medical device. If you want to go beyond this introduction to ISO 14971, we offer a wide range of online training programs on our website. In medical devices, we cover risk management, software development, and quality management. We also provide training in automotive and aerospace systems. You can find the link in the video description and in the pinned comment below. If you found this video helpful, feel free to like the video, leave a comment, and subscribe to the channel. And I'm curious, do you already work with ISO 14971? Or are you just getting started? And if you want to continue learning, you might also be interested in our videos on IEC 62304 and ISO 13485.